Hi, this is Michael Kaplan. Welcome to my YouTube channel, New Zealand Brain Health. We're going to be introducing a few patients to you, and we're going to do it in two parts. The first part, we're going to introduce a patient with constraint-induced therapy. He was already into his therapy for a couple of weeks, or actually for just a few days, and then we're going to interview his wife. In the second video, we're going to be talking about mirror therapy, showing about how a person progresses with mirror therapy and how it uses. And then the last patient will be a patient that has already used a combination of techniques and has made fantastic improvement. We don't just use these therapies. We also use a variety of different medications to help facilitate recovery after stroke, such as dopaminergic drugs and serotonergic drugs. Anyway, so we'll get on to the video in just a few minutes, and I hope you enjoy both parts of the video. Be sure to watch the first video, which concentrates on constraint-induced movement therapy. Hi, Betty. You had a stroke, and is it okay if I do a video of your hand and mirror therapy just to show people what mirror therapy is all about?
Yes, it's fine. And
let me ask you a question or two, too. When you came in with your stroke, do you remember what your blood pressure was?
Yeah, 237 over 120 or 130 something.
Right, 237 over around 120. And you could walk at first, but then the stroke extended and you couldn't walk and couldn't use your arm. But now you're walking independendly with a quad cane, aren't you?
That's correct, yeah.
But the hand hasn't come back yet,
No,
right?
No, not yet.
But we're going to show people what mirror therapy is. It's like a little box, has a mirror on one side, and then inside goes your hand. Your hand is affected, and you can't really lift that hand. But the concept is that using special neurons in our brain called mirror neurons, we tend to have recovery. Can you show us with that mirror box how you use it?
Yes, I just, I'm looking into the mirror.
Yeah.
And my hand is inside the box, and if you try and move your thumb there, we're hoping that the brain will be tricked into thinking that the hand that's inside the box, its thumb is moving too.
And just to let you know, on the same video, we're going to show another woman who can now move her hand completely, and she said a lot of the therapy helped because of her mirror therapy.
Yes.
So we're hoping that works with you. Certainly your leg has come back, but the hand hasn't. So just move your good hand and look in. I won't get you looking inside, but just take a look and look inside the mirror and pretend like your left hand is moving. I see. And can you flip it back and forth as well, your good hand? So you do different motions,
Yeah.
and then you try to get that hand working.
And it's starting to do something.
It is starting to do something? Let's take a look. See if we can see. It is starting to do something. You're right. It is. It is starting to do something. It's starting to flip over. Okay, now flip them back. That's the first time I've seen it actually starting to move. That's terrific. Let me help you place it back.
Thank you.
Okay. Okay, now let's see you flip again using your mirror therapy. And it's turning just a slight amount. Oh, there you go. Look at it moving. It is moving. That's great. And flip it back down. Can you do that? Okay, let me help you with that.
Yeah. Thank you.
Push it down.
Yep. Thank you.
Flat.
Yeah.
Okay, now let's see if you can turn it up again one more time. Oh, look at that. Look at that. You're picking it up and moving it. And it's turning. Oh, look at that. It turned around. Oh, my gosh. It turned around completely. It turned around completely. You couldn't do that yesterday.
No.
That made a big difference. Okay, let's do that one more time. Let me help you flip it back.
Yep.
Okay, now you look in the mirror.
Yep. Yep.
Okay, and flip it over again for me. There you go. You're doing it. Keep on going. Keep on going. Keep on rotating it over. Over. Fantastic. Oh, my God, you did it. That is really, really good. Thank you very much. And it's okay if I also show an MRI of the pictures of your brain, too?
Yes, it's fine.
Okay, thank you. And I'm just going to come back out again and show you how the brain gets tricked by the mirror therapy. Thanks again.
Thank you.
Now we're going to be taking a look at an MRI of one of the patients we looked at. And typically, hypertension is a problematic issue for strokes, especially high blood pressure is over 130 systolic or over 80 diastolic, which we've talked about in other videos. Other problems such as atrial fibrillation develop. This particular patient, the problem was a hypertensive bleed, and the location in the caudate nucleus will show it to us. What's typically a hypertensive bleed. You see, in this part of the brain, both sides of the brain tend to look the same. We can see that this side of the brain over here, and from this in the middle is called the ventricles, the right side and the left side. And this side of the brain, the gray matter looks pretty much the same. If we scroll on this image, let's say we scroll up higher towards the top of the brain, we see again both sides look about the same. As we scroll down, both sides look the same. Now we're starting to see those ventricles in the middle. Here they are pretty symmetrical, very symmetrical, pretty much the same on both sides. And now they're starting to look a little bit different because we're going further down the brain. And now we're coming up with this area here. This area here is a bleed in the thalamus. So you can see the bleed's getting bigger and bigger and bigger. And it's a pretty big bleed, and it's certainly different from this side. And we keep on going through, and now the bleed starts going away. As we get lower down to the brain, we see the eyeballs up front, so that's the front of the head. This would be the right side here. This would be the left side, eyeballs back of the head. And then a normal-looking brain, pretty much. And we come back up again just to get a feeling for that hypertensive bleed. There it is right there. There's the bleed on one side, which is the right side affecting her left limb. We can follow that bleed all the way through. Okay, so I think that might be some good information to tell you about what hypertension does and its effect on the arm. In this particular patient, the arm and the leg, but her leg's doing great, recovering well, walking with a quad stick, and the arm, as you just saw, is also recovered fantastic. Other patients in the video set are still in the recovery process with regards to their arm. Hi, Di. This is Michael Kaplan. We're going to do a video for YouTube of just your hand. Is that okay if we do one of just your hand?
Yes, good morning, Dr. Kaplan. Yes, that's fine with my hand.
Yeah, so let me ask you a question. When you had your stroke, could you move your left hand or your left leg?
No, not at all.
And now you're able to walk with this quad cane, I see?
I can, yes.
And your hand had no function at all?
No function at all, no.
And you worked really hard at that hand, didn't you?
Well, I did, but I had a lot of help too.
And
getting me to where I am now.
Yeah, what are some of the things that you did personally to make that hand work?
Talk to my thumb.
Yeah?
Talk to my fingers. Did mirror therapy.
Electrical stim?
Electrical, yes.
And
yes.
so it was a non-functional hand, and you remember the first thing, you couldn't even move the thumb to hold anything.
No,
you would
I
just
couldn't.
drop everything even when it started functioning. Is that right?
Yeah, true.
So
Couldn't hold anything.
couldn't hold anything. Did we do any constraint therapy with you?
No.
No, but we did the mirror therapy. Mostly it was your self-practice. Can you grab that for me? That's pretty good. I'll pick it up in the air so I can see it. That's great. And how about passing it over to me? That's good. Here, let me give it back to you. That's fantastic. And give it to me again. So would you say that you can almost do everything with the hand?
Yes, definitely.
And it's constantly improving, isn't it?
It is, yes, it is, definitely.
Constantly
Definitely.
improving.
I can grab things, I can... Yes, it's wonderful.